the Maria Holder Diabetes Center.
Lifestyle changes can be just as powerful as medication in controlling diabetes.
Hey, Alfonso! Why don't I get up out your bed? Do you hear what time it is?
What time it is, boy?
It's time for 15 diabetic friendly minutes on VOB 92.9 FM of the compliments of the Barbados Diabetes Foundation.
I is not getting up out of my bed to let you hear what is being discussed on today's show. In today's show,
Shoes is part of your foot routine. Make sure you have the correct footwear.
if you were about to leave home, you might need to stop and listen to what Dr. Diane Brathwaite,
That's Dr. D.
what she has to say about the correct footwear that you should be wearing.
So those are the two main complications that we're trying to avoid with diabetic retinopathy screening.
Stay tuned to hear what are those two eye complications that Dr. Charles Pierce is talking about. Plus, dietitian Victoria Cox exposes the real truth about that potato sauce that you have been eating every Saturday. These are the things I want to hear for true. I can listen. Who's the sponsors again? All with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that can wake you up from that dream and make it a financial reality. I know that one. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your number one choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
Happy Saturday morning, VOBers! Happy Saturday! Happy Saturday!
This is Peter Boys here, and you are going to be happy and healthy this morning, especially if you are diabetic or pre-diabetic, as I remind you all about the services that you can find at the Maria Holder Diabetes Center, located in Warren St. Michael behind Eunice Gibson Polyclinic, but in front when it comes to offering the best health services like vascular screening. So if you feel you might have bad circulation and your feet keep swelling up, you might need to get a vascular screening or eye screening for diabetic retinopathy. Once you are diabetic, this is something that you should be looking to do every year. But you might be a diabetic and you might be saying,
I didn't get my eyes screened recently and my eyes feel oily. I don't feel like nothing wrong with them.
so I asked Dr. Charles Pierce, clinical lead of the Barbados Diabetic Eye Screening Program, what symptoms you might experience if you may be getting diabetic retinopathy.
Vast majority of people who have diabetic retinopathy, they're going to experience no real symptoms. So in the mild, moderate, or severe class of diabetic retinopathy, there usually are no symptoms of the disease. However, if you start to develop, for instance, leakage in the center of the macula at the very back of the eye, then you can start to lose that central vision. So you get cloudy vision in the center area. So faces, for instance, if you look directly at someone, if you're blurred, you're not able to distinguish letters or have difficulty reading. So that's what can happen when you have macular edema, which is a term for leakage in the center of the retina at the back of the eye. You can also develop these abnormal blood vessels that grow on the retina, and they can start to bleed. So you might notice new onset of floaters, and sometimes they're pure red. So you know that's actually blood in the eye. And these abnormal blood vessels that are there, they can start to scar, like a scar anywhere else on the body. And when they do that, they pull on the retina. They can actually pull the retina off. And in that case, you can have a significant loss of vision as a result. So those are the two main complications that we're trying to avoid with diabetic retinopathy screening.
So when a person starts to experience those symptoms, would it still be useful to get their eyes screened?
Absolutely. If they have not been seen by an eye care professional, then screening is still an option, and then you can be referred appropriately after the screening process.
Dr. Pierce, some people might feel that instead of getting their eyes screened every year, they would go every 2 years and save some money. Would that be okay?
Ideally not. We recommend, and most organizations across the world recommend, that all diabetics have an annual eye check to make sure that there's no evidence of progression, because like I said before, these changes can be happening and you have no symptoms, you have no idea that anything is going on with the eyes. So it's very important that someone has a look to see if there are any signs of diabetic eye disease.
What is the treatment for diabetic retinopathy?
There are two main forms of treatment. There are injections of the drug. There are several different drugs that you can inject into the eye. And unfortunately, when people hear injecting into the eye, they're thinking it's going to be a painful experience, but it's not. In vast majority of cases, you don't actually feel anything. And the drugs that we have available work very well to get rid of the swelling at the back of the eye and can significantly improve the vision. The other option in terms of treatment is laser. So the laser is usually applied for abnormal blood vessels, and what we do is we apply the laser on the outside of the retina, and it causes these blood vessels to shrink, and then they're less likely to bleed, less likely to scar, and then less likely to create problems in the future. So those are the two main modalities of treatment that we have, either laser or injecting a drug into the eye.
Dr. Pierce, how could an injection in your eye not be painful?
Well, so we put in lots of anesthetic drops, and that's the first thing. And the second thing is it's a very, very thin needle. So in both of those two factors together mean that most cases you don't feel anything when you're doing the injection.
Thank you, Dr. Pierce, for that eye-opening segment. You listening to VOB, call 243-3937 and make that appointment to get your eye screened here.
The Maria Holder Diabetes Center.
As we move on to another eye-opening segment, but this time about your feet. This is Dr. Diane Brathwaite, and she is saying that
Shoes is part of your foot routine. Make sure you have the correct footwear. Make sure you're not wearing something that's squeezing your toes in. So sometimes dress shoes really are not suited to persons with diabetes because of the risk of injury with squeezing. Okay? If you have swelling on your feet, make sure you put your compression stockings early on in the morning before the swelling starts, and then put your footwear on. And your footwear, we would have gone through this in a previous post, should be something that's comfortable. You should have a wiggle room in your toe box. The toe box should be adequate, meaning that it's not pressing down on the toes. Especially if you have hammering in the toes, you might need a deeper toe box. Your shoes should have good clearance off the ground. So you really want something that's probably closer to an inch off the ground, and the sole shouldn't be easily bendable. So if something sticks the bottom of the shoe, it doesn't go right through the shoe and stick you in your foot. Do not wear shoes that have thong slippers. If you have a sandal, it's best to have a strap that comes over the front and one that comes around the back of the foot so that the foot is held in place. People who wear slides or sandals without shoes, sometimes you find that you're actually walking and you're constantly gripping the shoe with your toes, and there is movement back and forth which can be problematic for some people. Make sure that if you are having a sneaker, it's actually either sealed properly with the Velcro, or the laces are put up properly so as to not squeeze the foot but still to hold the foot in place. And in general, if you have an enclosed shoe, you should have a finger breadth between the longest toe and the front of the shoe so that your toes are not hitting the front of the shoe as you're walking throughout the day. Please wear your most comfortable shoe. I shouldn't say that. Please wear the most secure shoe if you're doing a lot of walking. And in general, I advise that you use sneakers when you're doing a lot of walking versus dress shoes. And that's just to reduce the risk of injury, but also cramping of the foot and discomfort. Make sure your shoe has arch support. When you're going to put on your shoes, shake out your shoes in the morning. Make sure there are no little rocks or pebbles in the shoes. Make sure you don't buy enclosed shoes that have seams on the inside or any hard material that can rub against the foot. So that's talking a little bit about care of the foot, but please get added advice and reinforcement by talking to your own personal healthcare provider.
Hello? the Maria Holder Diabetes Center radio show. I have a question for nutritionist Victoria Cox. I love my pudding sauce. I don't feel excited unless I can let my sauce from my favorite sauce lady. So, Miss Cox, my question is, how can something as good as pudding sauce be bad for you? And what do I have to watch out for if I is a diabetic?
When it comes to foods like pudding and sauce, again, I understand that we have these, cultural meals we really like to enjoy, but of course, not all of our cultural meals are necessarily the healthiest. So with something like pudding and sauce, from an overall health perspective, the pudding could be, particularly fatty cuts of pork, so high in saturated fat. It's not necessarily great for our, cholesterol and cardiovascular health. I'd also be pondering about the sodium or salt level in the cooking. As far as individuals living with diabetes, the sweet potato pudding is where the starch and natural sugars are going to be coming into play, and that's what's going to be dictating, how high someone's blood sugar is going to go. So as far as still wanting to enjoy something like pudding and sauce, I would at least, in the very least, suggest trying to have lean sauce and controlling the portion of pudding.
We go from Victoria Cox focusing on sauce to our Saturday song of the day, and it's a sauce song. Remember, you can make an appointment with Victoria and get your own personalized meal plan. But right now, this is Captain Sawyer getting you ready for Crop Over 2026 with The Girls Want Sauce. Compliments the Maria Holder Diabetes Center and Republic Bank.
When it comes to foods like pudding and sauce, not all of our cultural meals are necessarily the healthiest.
Cajun sauce. Jamaicans, jerky. Bajans, work it. Lucians, roll it. Trinis, done it. Jamaicans, jerky. Bajans, work it. What you talking about? Cajun sauce. Red and back in sauce. I don't make a sport. I just only use proper pork. It's so good and funny. It's so shiny. But the black pudding just got that tantalizing on the same malt.
Maria Holder Diabetes Center.
We want sauce.
I have had diabetes for just over 8 years now.
How did the services of the Maria Holder Diabetes Center help you?
I utilize the diabetes specialist nurse, the podiatrist, the nutritionist, and of course the doctor. The staff there, but it is really nice and they're supportive and they help me through a lot of my problems. They taught me about calorie counting, learning how to balance my meals. They helped me not to be insecure about having diabetes. It's something that I have to live with and to love myself, to be confident in everything I do.
Cutting edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Diabetes doubles your risk of heart disease. Know your numbers today.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100. But members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
The Maria Holder Diabetes Center.